And this is last chance surgery. Tonight, Christine has a time bomb in her head.
I need to have this operation done because if I don't do anything, I'm going to die. So.
Her last hope, rare surgery, using a part of her leg to save her brain. Jessie's moment of truth.
He's got enormous courage.
The operation is over, but will he walk again? And Shaynae's brave life or death decision.
We're looking for a miracle. I mean, they do happen.
Will she decide to have surgery on her brain tumour? In the city of Hobart is a couple who look like any other young pair in love.
Normally goes without saying, but yeah, I do love Christine very dearly, and yeah, she's a wonderful girl, and I couldn't imagine spending my life with anyone else, nor would I want to.
But Christine could be dead tomorrow. Inside her head is a time bomb, and it's ticking.
I've had to live with it knowing that I've got this time bomb, which is fine. No, it's not really fine, but
This is why Christine could die at any moment. In one of the arteries in Christine's brain, the wall has become weak, and it's expanding with blood like a balloon. The bigger it gets, the higher the chance it could burst, and Christine could have a massive stroke or die. The time bomb is called an aneurysm.
well, it's in the back of your mind that, I mean, it could be tomorrow that your aneurysm could burst, and that's not a great feeling.
Christine's aneurysm is so large that no surgeon in Tasmania could rescue her. So Christine and Nick are driving all the way to Sydney to meet one of the few doctors in Australia who can save Christine's life.
The odds are very much against her in the long run.
Christine is hoping her hero will be Professor Michael Morgan.
In cancer, we can be, we know that a cancer needs to be chopped out because sooner or later it's going to overwhelm the patient's body and lead to their death. But in aneurysms, it's a bit of Russian roulette. As the aneurysm gets bigger and gets towards your size aneurysm, the risk of bleeding in the near future increases markedly. You know, certainly patients die. So, it's okay, Christine.
The main thing I heard was the fact is if you don't have this operation, you're going to die. You realise I need to have this operation done.
It's 3 days since Jessie's massive spinal operation. Without it, he would have been in a wheelchair within weeks.
It's all very well to cut out great sections of the spine, but you've got to kind of put it all back together.
We hope this is going to be the final chapter for Jessie, and we don't see any reason why it shouldn't be.
Jessie had a tumour in his spine that had destroyed the vertebrae and was pushing on his spinal cord. Surgeons got the cancer out, but then had to reconstruct his spine, all the time making sure his spinal cord was protected. Since then, Jessie has been kept heavily sedated, and now routine checks have uncovered a potential disaster. Jessie is not moving his legs.
So when was he last moving both of his legs? When I saw him yesterday. Well, I guess we need to know whether he can move or not.
Yeah, I think we'll have to reduce his sedation and then check that out.
The staff here will ease off on the sedation and on his analgesia to let Jessie wake up a bit, and then we should be able to observe properly whether he's able to move his legs normally. If not, then we'll have to get a scan done and have a look and try and see why.
It's an anxious wait before finally the results.
We have lowered the sedation, and he's moved both legs briskly. So there's no concern there anymore that he hasn't got any neurological damage.
That's a massive relief for Mum and Dad.
Hello, Jessie.
Hello, Jessie. Jessie. Is Dad and Mum here?
Jessie.
All's well. He looks all right. Good colour.
And waking up is the next milestone they'll look forward to. For Shaynae, everything is riding on the decision she is about to make. It will determine how long she has to live.
It is very important because it depends on the rest of my life and how I live it.
Inside Shaynae's 17-year-old body is a deadly cancer, the worst kind of brain tumour. It's growing so quickly, these could be her last days.
Without aggressive treatment, she is extremely unlikely to survive.
No surgeon would operate, but her father was desperate and brought his daughter to Dr. Charlie Teo.
The things you're losing in the long term, you know, your child being married, your child having children, your child, and all those milestones in life, you know, you want to see them, you know, and I still want to see them, you know. So it's just we've got to try and everything we can to sort of try and get to those milestones.
We're looking for a miracle. I mean, they do happen. I hope.
They needed to hear the facts. Could Dr. Teo give their little girl more time?
And in 75% of cases, it is worth it. We get good results and we get prolongation of life or cure. In many cases, we've had cure. But boy, when things go bad, they go terribly bad. So if we can talk about the risk of your surgery, because it's already starting to affect some very vital things like memory and level of consciousness, I think the risk is extremely high. I think you're looking at almost 100% risk that you are going to get something going wrong, and probably about a 15 to 20% risk that that thing that goes wrong could be devastating. You know, being a vegetable, not waking up, being a persistent coma, bilateral paralysis, you know, both arms, both legs, I mean, just something terrible. My job is to honestly give them the facts. And my job is to not pull my punches and to lay it on the line and then let them make up their mind.
And now Shaynae must make that decision. The latest MRI scan shows the deadly tumour is growing. But it's not too late. Dr. Teo will still operate, if Shaynae says yes.
I see her deteriorating very rapidly. You know, Charlie might be the answer. I just don't know. But it's hard. This is hard. It feels like her whole life is pivoting around this decision.
The enormity of last chance surgery has hit Christine. She needs to have an operation on an aneurysm in her brain. It's far from a routine procedure. It's rare, difficult, and risky. To be able to clip the aneurysm in Christine's brain, they will use a vein from her leg to bypass the aneurysm altogether. Then they can shut down this time bomb.
And then we'll make an incision from your knee down to your ankle, okay? And we will take the vein out, and there's plenty of other veins that do the job of that vein, so it won't be missed in the leg. And we will join it up from the neck to the brain so that we can secure the supply beyond the aneurysm. The surgery, we just have to do our best. I think that the risks that I've quoted of 15% are very real. You know, certainly patients in my hands die with having this surgery.
I just have to accept that, because if I don't do anything, I'm going to die, so. But that seems fairly good odds, I suppose.
4 days ago, Jessie underwent mammoth last chance surgery to get rid of a tumour in his spine. Without the operation, he would have become a paraplegic. Surgeons have been forced to keep Jessie on his back and sedated since the operation. But now, the news Jessie's anxious family have waited to hear.
I'm going to take that breathing tube out very soon, and I'm pretty sure he'll cope all right. When we talk about taking out the tube, he kept nodding. He wanted it out. I don't blame him. It is very uncomfortable.
Stand here. Mum will be here this afternoon sometime.
So look, he doesn't understand. So look, I think he's ready. Yeah.
Oh, this is good.
You got any questions?
No, you've been quite informative.
Oh, you do, I know. He does. He does.
You all
all
got
right.
questions, have you?
When we take that tube out, Jessie, then you can ask us, all right? You can ask us as many questions as you like. Is that a deal? Okay.
He's got a sense of humour still.
Yeah.
Good on you.
I'm pretty sure that by the end of the week, he'll be getting up, sitting out, taking steps, and weight bearing, so forth.
6 days after his operation, it is Jessie's moment of truth.
We're going to keep you on your side and log roll you. We're going to just sit you up, have a couple of seconds in sitting to see how you feel. Then we're going to stand. And on the count of 3, Marg's going to take your legs down and we're going to come up. Are you ready?
Yeah, go.
1, 2, 3. Push down.
Up you come, Jessie. That's the way. Good shot. Wow. How do you feel?
A bit dizzy.
That's all right.
Dizzy.
Okay.
Just move your feet up and down, Jess, like this. Up and down.
That's it. Okay, take some breaths and paddle your feet.
Keep moving your feet up and down.
All right, so on the count of 3, we're actually going to stand up. Are you ready? Nose over toes. Yes, that'd be good. 1, 2, 3. Now up towards...
Head up, Jess. Tuck your bottom in and straighten your knees.
Beautiful.
Fantastic.
Less than a week ago, Jessie was going to become paralysed. Now he's walking. Only a few steps, but they are a milestone for this brave young man. Last chance surgery has worked.
Good man. That's fantastic.
Tomorrow, Christine will have surgery to save her life.
Afternoon.
This is Christine.
Today, Nick has found a rather romantic way to keep Christine positive. He proposed, and the pair can't wait to share the news with Christine's mum and sister, who have arrived from Tasmania.
Hi, Nick. Congratulations.
Thank you.
You'll be right. You'll be right. Sweetheart. It'll be cool. It'll be cool. Of course it will. Oh, you couldn't wait to look at my hand, could you? Understandable.
Congratulations.
Thank you.
How are you feeling?
A bit nervous. I'm all right, really. I'm just a bit charged up.
Yeah. Anxious.
A little bit, yeah. Understandably, I suppose. But, yeah, be cool. It's just really nice to see you both. Sorry.
It's all right. You're all right. Come on. I think it's going to be fine. Second time, mate.
Yeah, I know. Well, apparently a cat has 9 lives. I've used a few up.
But in her operation, Christine will be relying on more than luck or superstition.
I think that the risks that I've quoted of 15% are very real. You know, certainly patients in my hands die with having this surgery.
The life of Nick's future wife is now in the surgeon's hands.
You're going to push yourself up using your hands.
Since his 18-hour spinal surgery to remove 2 vertebrae and a tumour, Jessie has been through painful physiotherapy every day. Each session, he takes more steps. A week earlier, Jessie and his family feared he would soon become paralysed. Now he's walking, but it will be a slow recovery.
That's fantastic. Doing very well, Jessie.
I think Jessie will start to pick up quite quickly now that he's eating, now that we're getting more fluids into him orally. He's feeling a lot better in himself. I think he'll start to get back on his feet again quite quickly, and I'm hoping that by the weekend, it's about 5 days away, that we might get him home. We'll see how it goes, though, over the next couple of days. Hello, Jessie.
Hello, Dr. Watkins.
Mr. Carroll, how are you?
How are you?
Nice to see you. How are things going?
Oh, I feel a lot better today.
Do you? That's good. So, how many times have you been up today?
I had three attempts. I got twice I got up.
Did you? Well done.
Oh, thank you.
That's great, Jessie. And how's your back feeling?
I feels okay, just like trying to find the most comfortable spot to sleep in bed.
Still a bit sore?
Oh, the bed doesn't get any softer, so...
Fair enough. All right. Well, I think in the next day or two, once you can tolerate standing up for a bit longer, we're going to take an X-ray and see how it's all looking.
Oh, okay.
See how all those nuts and bolts are going. Considering he basically got cut in two and put back together again, he's got enormous courage. Yeah. Great young man.
The X-rays taken over the next few days are promising. Professor Watkins is happy. Jessie's last chance surgery to keep him walking has been a success. And with his loving family beside him, Jessie is slowly heading home to the garden he loves that he will work in once again.
Thank you.
See ya.
Shaynae is about to make a gut-wrenching decision that will determine how much time she has to live. In the past 24 hours, Shaynae has found out she will die within weeks if she does not have surgery on her brain tumour. But the reality is, even the operation could kill her. Shaynae must decide whether to have the operation.
I think I just want to go home. Yeah. All right.
It's okay, Shaynae. It's your decision.
No surgery, no treatment.
Can't even describe what I'm feeling other than immense pain. I just can't understand who and what has the power to pick and choose and take from you. I wish it was me.
But it's hard, you know. It's a short in a life. You know, I was hoping for a lot longer, you know, but we're not going to get that. And, you know, there's no miracles in this world, I don't think, when it comes to sort of brain tumours.
I don't think it's a foolish decision. I just want to make that clear to you too. You could have gone one way or the other. I told you I'd go with this surgery, but I don't think you're being foolish at all. I think it's a very reasonable decision. It's not what I would do, but it's a reasonable decision. It's based on good informed consent. It's based on, you know, all the things that you've seen, your own personal experiences and stuff, and I think it's a very brave and reasonable decision to make.
Thank you.
I think she's lost enough quality of life to not want to lose any more. I think basically that's what she was saying, that if there's any chance at all of me losing more quality of life, I'd rather just die. An incredibly brave decision.
But the decision's been made, and that's why she wants to go, and I'll support her, you know, all the way.
Go home and be happy somehow around her. Give her some happy moments for her last moments.
See you, gorgeous girl.
See ya. Thank you very much.
Okay, no, it's a pleasure.
It's been 4 weeks since 17-year-old Shaynae bravely decided not to have surgery. She just wants to make the most of the little time she has left.
Happy birthday to you. Happy birthday, dear Shaynae. Happy birthday to you.
Even though today she looks absolutely wonderful, I've noticed big changes in her. Her eyesight is very, very blurry. She continually has to wear glasses, and we've had to block out any form of light in the house.
You know, she's not the girl she used to be, but, you know, but I still see things in there that remind me of the girl she was.
She's the best.
I think she's still happy with her decision. I mean, when she came back, there was people sort of asked her why she made that decision, and she was sort of, you know, very guarded about saying, you know, this was my decision, and, you know, can you let me just live with my decision?
Thank you everyone for coming today and caring. Thank you very much.
this situation that's arisen with Shaynae has sort of opened my eyes to what it means to lose someone as important as your daughter, my only daughter.
Shaynae, I just want to say to you how much I love you with all my heart. You're my best mate.
I wouldn't wish it on anybody, and I love it a bit.
And I love you forever, and I know in my heart you're always, always, always there.